Hello, I'm Dr. Stephen Cragle from St. Cloud Ear, Nose, and Throat Clinic. Today we're going to be talking about cochlear implants. What is the difference between a cochlear implant and a standard hearing aid? Who would be the best candidate for a cochlear implant? And are people happy when they get fitted with a cochlear implant? We'll be talking today with Jessica Landucci, one of our audiologists here at St. Cloud Ear, Nose, and Throat, who specializes in fitting cochlear implants. So first off, let's talk a little bit about the difference between a hearing aid and a cochlear implant. What would you say, Jessica?
The biggest difference between a cochlear implant and a hearing aid is how sound is delivered to the ear. A hearing aid sends sound down the ear canal and acoustically delivers sound to the ear, whereas a cochlear implant electrically stimulates the auditory nerve through electrical impulses. So surgically, a small electrode array is implanted down into the inner ear called the cochlear. There is both an external portion that sits on the ear or behind the ear, and this internal portion. With a cochlear implant, the external portion picks up sound through microphones. It then sends that information down into that surgically implanted electrode array where the nerve is then stimulated.
That is so interesting. Now, just to give you a little visual on this, this is a device that is not a true cochlear implant, but it's made to look exactly like one, with the processor portion, or the receiver stimulator portion here, and the implantable wire here. I'll do a little close-up here so you can see that a little bit better. This is the portion that goes under the skin. This is the portion that goes through the bone into the inner ear and actually does the stimulation. So, Jessica, who would you say is the best candidate for a cochlear implant?
The best candidate for a cochlear implant is someone with severe to profound hearing loss and difficulty understanding speech. There are times where people with less severe hearing loss are considered candidates, especially if they have a lot of difficulty understanding words. Because cochlear implantation is not a quick fix, it really is reserved for those patients who can no longer successfully communicate with their hearing aids.
That's really good to hear, and it's amazing how many people really would benefit from a cochlear implant. But when you get down to it, are people really happy with their cochlear implants? What do they say after they've been fitted with a cochlear implant and have gone through the rehabilitation process?
Cochlear implant patients are happy, and it can have an amazing impact on their ability to understand speech and communicate. But it is also a process. As we've talked about, implants electrically stimulate the auditory nerve. Because that's not what our brains are used to, it takes patients a while to make sense of what they are hearing. Initially, sounds and speech can be distorted. They can sound like beeps or buzzes or be really unintelligible. Although this is part of the process and an expected part of the process, it's difficult and can be frustrating. But really, patients in the long run are very happy with how they're able to communicate with people further away from them, who are not looking directly at them. They can oftentimes understand telephone calls and TV better, and really the difficulty that they go through in those initial several weeks is well worth it with the improvements that they see.
Well, that just about wraps up our time. Hopefully this has been instructive for you, and if you have loved ones or if you yourself are suffering from significant hearing loss and you're not able to get full function with your hearing aids, you might be a candidate for a cochlear implant, and we would be happy to answer your questions and assist you with your hearing needs here at St. Cloud Ear, Nose, and Throat.